This Be More Lifestyle segment is sponsored by Natera.
According to the American Cancer Society, colorectal cancer is the third most common cancer in America. Well, joining us now is General Manager of Oncology at Natera, Solomon Moshkevich, with the latest treatment options for detecting or monitoring CRC. All right, so welcome to Be More Lifestyle. First, is it easy to find out if you have an inherited CRC gene?
Yes, about 5 to 10% of all CRC diagnoses are linked with an inherited mutation. And it is easy to find out if somebody is a carrier of one of these genes that is predisposed towards CRC. There are tests available that are simple blood tests. One is called Empower that can be ordered from Natera's laboratory with a physician's order. And if somebody finds out that they have an inherited gene, then they're eligible for additional screening. There's something you can do about it to protect yourself from CRC.
So talk to us about the latest tests or technologies that are available to monitor for CRC recurrence.
Yes. So for people who've been diagnosed with CRC, this is not about cancer awareness. It's about many people living under a cloud of anxiety, wondering if their cancer is ever going to come back. Now, about 20 to 30% of people who've been diagnosed with CRC are going to experience a recurrence at some point in their lifetimes, usually within the first 3 to 5 years. Traditionally, people have monitored for recurrence with a combination of CT scans and serum biomarkers. These are simple blood tests that were developed decades ago. Now there's a new technology called Signatera that can detect tiny traces of the tumor, even in a tube of blood, with very high accuracy up to 2 years earlier than it becomes evident on a scan.
Who is most at risk for colorectal cancer?
Patients can be at risk for multiple different reasons, and you should talk to your oncologist whether you're considered at increased risk. But studies have shown that patients who test positive with Signatera have a probability of recurrence that's higher than 98%. And so those patients, they need to know as early as possible so they have a chance at earlier intervention that can be curative. Meanwhile, for patients who test negative with Signatera, that brings really enormous peace of mind, knowing how high the sensitivity of the test is for recurrence, and that can help people get on with their lives.
And where can viewers go to get more information?
Visit Natera's website. That's natera.com, Natera.com, to learn about both of these different tests.
Great information. Thank you so much for being here today.